Hi and welcome. I'm Seth Truger, Digital Media Editor of JAMA Network Open.
And I'm Mike Berkowitz. I'm Electronic Editor of JAMA and the JAMA Network.
We're going to talk about some of the great papers that came out this week in JNO. If you have questions, please comment on Facebook or respond on Twitter, and we'll try to get to them in real time.
And we'll do as best as we can to answer them fully.
First paper we have is the association between obesity and cardiovascular outcomes. This is a systematic review and meta-analysis of Mendelian randomization studies.
Mendelian randomization studies, Seth. I've been hearing a lot about that. What can you tell me?
So this is a relatively new technique that tries to take advantage of the genetic variation that people have and get assigned at birth to try to replicate the kind of randomness that happens in a clinical trial.
Cool. What did this study do?
So what they didn't do the Mendelian randomization themselves, but here the authors, Riaz and colleagues, looked at they did a systematic review of all the studies of obesity and cardiovascular outcomes. They found 5 studies that used Mendelian randomization to look at obesity and how it impacted outcomes and assess the rates of type 2 diabetes, coronary artery disease, and stroke.
So are they basically looking to see which genetic variants are associated with those outcomes and obesity?
Well, what they're trying to do is see if there's a link between obesity itself and these specific cardiovascular outcomes. It can be really hard to disentangle these sort of things, because if obesity is a problem, does it lead to diabetes? Does it lead to heart problems itself? Does it lead to stroke? Or are all these all just caused by the same independent factors? So as an observational study, Mendelian randomization can't actually answer the causality, but it can try to give us more information about these links.
So it's kind of a more precise estimate, because by mimicking randomization, it gets rid of some of the confounding that we see in the observational studies.
Right, exactly. That's the goal, is try to see, is there more of a direct link between, say, obesity and stroke or obesity and CAD?
So what did they find?
So they found that pretty much yes. They found obesity was linked with type 2 diabetes. It was also linked with an increased but smaller risk of CAD, but they found no link between obesity and stroke.
Well, that's interesting, but I thought we knew that obesity is significantly, statistically and clinically significantly associated with type 2 diabetes, so that's no surprise, right?
Right, exactly. These results aren't terribly surprising, especially as a systematic review. It's reviewing data we already had. What this tries to do is help us disentangle, is obesity separately linked to diabetes and CAD, or is it independently linked with both of them? And potentially maybe down the road we'll help figure out what the causal linkages are.
And do the authors point to any future directions or next steps?
Well, I'm sure they do. We always look for more, always call for more research at the end.
I just wasn't sure what the next step is, but there is a companion paper in this release, right?
Right. We have, the next paper we have is another paper in JAMA Network Open this week called The Association of Obesity with Mortality Over 24 Years of Weight History. And this findings from the Framingham Heart Study, and this is by Zhu et al.
Cool. So tell us about that, because that's out of Framingham, which is a revered cardiovascular epidemiologic study.
Right. So what these authors did was look at the Framingham data. They looked at the first 2 cohorts. For those of you who aren't familiar, Framingham is one of the first big studies that really looked at people over time to see what sort of things were linked with CAD. Started back in the 40s, and they've been studying a cohort of thousands of patients. They then studied the second cohort, the second generation. They're now even studying the third cohort, the grandkids of the first generation. In this study, what they do is try to see if obesity history overall is linked with coronary artery disease. Or excuse me, mortality, not coronary artery disease specifically.
Right, so all-cause mortality in this study. And what did they find?
Right. Well, what they did was a little interesting, because most of the studies of obesity and mortality or other risk factors really look at your BMI or your weight at one specific moment in time. And what they do is look at 24 years of a patient's history and see what basically your maximum BMI is at any point and how that links with your mortality.
Great. And do you have a sense, given the investment in the Framingham study in cardiovascular epidemiology, why they looked at all-cause mortality, which is undeniably important, but why they didn't kind of tease out the cardiovascular specific causes of mortality?
Well, I imagine there's a bunch of different ways you could look at this data, and this is just one great way to start looking at the mortality itself, because they did find a higher link and a higher kind of linear increase in mortality as your BMI goes up in kind of big chunks of BMI. They did look at a ton of different subset analyses and things like that, and there are a lot of interesting findings in here, but the main finding is that there is pretty much a linear increase in mortality with higher BMIs of what your maximum BMI was at any point.
So BMI defined obesity is bad for you. I think I'll ask the same question again. Did we not know that?
We knew it. There's also the obesity paradox, that people who are overweight, so higher than normal weight by BMI, but not obese, become measured as healthier in some ways. And this study did not show that in their primary findings. They showed it was just a linear increase as you went from normal to overweight to obese, and to even higher levels of obesity, higher mortality came along with that.
Interesting. So the standard risk factors that we talk about for cardiovascular disease were in fact originally Framingham risk factors. Smoking, diabetes, hypertension, and lipid disorders are all associated with cardiovascular disease based on the first cohort from this study. And they're used in risk prediction equations. Do you think this gets us to a point where we can say obesity should be a fifth Framingham risk factor, or is that jumping the gun?
It's probably jumping the gun at this point, but it certainly leads us more towards that being a finding that we'll probably agree on in the future.
Great. Wonderful.
Great. Next paper we have is a bit of a change in gears. This one is by Moreno et al. Social media posts by recreational marijuana companies and administrative code regulations in Washington state.
That's very contemporary.
Right, absolutely. So as states are getting more and more into legalizing marijuana for both medical and recreational purposes, what these authors did is look at to see if the companies that sell and market marijuana are actually following the state regulations that come along with it.
And how characteristic is Washington's effort to regulate advertising around marijuana of what's happening nationally? Do you have any sense whether this applies? It's interesting within Washington state, but does it apply to other markets like Colorado and I think Illinois? Illinois is not there yet, but
yeah. To be honest, I'm not sure about that, but there's only a few states that have actually legalized marijuana for recreational purposes at all. Even medical marijuana is only legal to a limited extent in a number of states.
And so what are the specific restrictions?
So there's a number of restrictions that Washington has. Excuse me. First, they're not supposed to encourage overconsumption. They're not supposed to promote therapeutic benefits.
Smoke in moderation. Smoke your weed in moderation. Yeah.
Right. They're not supposed to promote any therapeutic or medical benefits to marijuana. They're not supposed to appeal to youths. And also, they are required to give warnings for things like intoxication, driving, health risks, and age restrictions.
Okay. And so what this is looking at is they have these injunctions or these restrictions, and the extent to which the recreational marijuana companies are advertising on social media and violating one or more of these categories of restriction.
Exactly. And not surprisingly, they found that a small fraction of companies, or a small fraction of the social media posts, were actually in violation of the regulations.
And what can you say more about that? Like, let me ask you this. It's social media. That's a broad kind of category. Is this just Facebook and Twitter? Is this Instagram? Is it Reddit? What are the other, Snapchat for the adolescents? What are we talking about here?
Right. So in this study, they looked at about 1,000 Facebook and Twitter posts, and they found that about 13%, 137 of the posts promoted therapeutic benefits. A small fraction, about 1%, appealed to youths, and about 2% encouraged overconsumption, and that about 10% of the posts didn't have the warnings they were supposed to have.
Interesting. So I would have thought this, for me personally, I would have thought this article would be more interesting if I could see sample posts or tweets that actually violated the restrictions to understand. I mean, we know around e-cigarettes and vaping that the companies are really going after the adolescents. So only imagining that some of the colorful, kind of youth-oriented advertising is occurring in this space too, but it would have been interesting to see that, at least to sensitize us as the grown-ups in our society to kind of what's happening in this space.
Right. I was actually kind of surprised that the targeting of youth was actually the lowest number of violations they found. It was only about 1%. Although it was interesting, some of the posts included, familiar characters such as Kermit the Frog.
Is that right? And this goes well beyond the paper and anything you might know. But do we know kind of how adolescents, is there any epi data on how adolescents are consuming recreational marijuana in Washington state since its legalization, ED visits, things of that sort?
So I can't tell you I'm familiar with all the data. I know we published a paper in JAMA Network Open a couple weeks ago that there's an increase in vaping and not just traditional sources of smoking, like regular bong use or marijuana cigarettes, joints, if you will.
Right. Yeah, one of the things I found most interesting is that one of the references was to a marijuana article by Jay Weed in Forbes magazine. So I thought that was kind of an interesting irony.
Right. So that's another study to look at if author surnames lead to their areas of interest.
Right. Well, that's it, I think, for today in terms of our articles, or do you have anything else to say?
That's what we got today. Thank you so much for joining us today. You can read these articles and the rest of the issue at JAMANetworkOpen.com, and be sure to follow us at JAMA Network Open on Facebook, Twitter, and LinkedIn.
And we're going to try and do this Facebook Live and Twitter stream periodically, so follow us and stay tuned for the next episode.